Hi, my name is Kelly Snyder. I did my evidence-based research project on chlorhexidine baths and the reduction of central line-associated bloodstream infections. Central line bloodstream infections, also known as CLABSIs, are infections that take place when a patient has a central line, and what happens is bacteria can travel down the catheter of the central line and enter the bloodstream. Some facts and statistics on CLABSIs are, from the CDC, there are an estimated 41,000 CLABSIs that annually occur in the United States. The cost of each CLABSI is around $16,550 per occurrence, and the mortality rate of CLABSIs is 15 to 25% per episode. So why is this important? Well, in 2008, Medicare and Medicaid decided that CLABSIs are now preventative health infections, something we can prevent, and they're not going to reimburse for them. So what can we do? The best thing to do with any healthcare provider to decrease the incidence of a hospital-acquired infection is good hand washing. Another thing is to just get the line out as soon as you possibly can. And the CDC has also recommended the use of the 2% chlorhexidine gluconate impregnated wipes or solutions for daily bathing of patients. So the chlorhexidine gluconate, it's a broad spectrum. It provides a rapid bactericidal action, and it interrupts the cytoplasmic membranes, and it can also remain active for hours after the use of them. Skin cleansing with chlorhexidine actually started back in the 1970s, and it was to reduce the skin flora, so the bacteria that's just naturally on the skin. It's effective against a broad range of bacteria, including gram-positive pathogens, so like your Staph aureus, your MRSA, your MSSA, VRE, Streptococcus pneumonia, coagulated with the staph. And it's also effective against the gram-positive pathogens, such as your Enterobacters, your Cinnobacters, Klebsiella, Pseudomonas, Serratia, things of that sort. And so what I did for my project was I went on to Mount Aloysius Library and the University of Pittsburgh Medical Center libraries, and I did searches on Medline and PubMed using keywords chlorhexidine baths, central line infections, things of those sorts. And I found 5 great studies that I'm going to discuss with you now. So the first study was actually a very recent study that was just published earlier this year in the New England Journal of Medicine. And it's entitled Effective Daily Chlorhexidine Bathing on Hospital-Acquired Infections. So one good thing about this study is it's a multi-centered study. It was done in 6 ICUs and a bone marrow transplant unit between August 2007 and 2009. The units were randomly assigned whether or not they should use the chlorhexidine gluconate baths or an antimicrobial bath that is also a product of the Sage company, which all of the studies have used, and it's just like a comfort bath. The nurses were told how to use the baths beforehand, and the study reported that the use of the chlorhexidine bath did decrease the incidence of central line infections. In fact, the incidence was 53% lower during the intervention period than during the control period. The incidence of the central line infection was 1.55 versus 3.30 cases per 1,000 catheter days. The study also made note that in June 2008, when the study was being conducted, this manufacturer pulled the product off of the market because it was contaminated with a bacteria. Not only did they find there was a decreased number of central line infections, but they also found that it helped with a decreased number of fungal infections for these central lines. And most of the bacteria that it did decrease on were the gram-positive bacteria. The second study I looked at was called Effects of Hospital-Wide Chlorhexidine Patient Bathing on Healthcare-Associated Infections. This study took place at a 689-bed academic medical center. All of the units in the hospital were included in the study except for the neonatal intensive care, labor and delivery, and the newborn nursery. The study consisted of a quasi-experimental dose-ranging staggered introduction into 3 cohorts of inpatients. The cohorts were based on hospital geography. So cohort 1 consisted of the 5 adult ICUs and pediatric ICU units. Cohort 2 consisted of patients in Bed Tower A, which was just a general adult and pediatric patients. And cohort 3 consisted of patients housed in Tower B, which was adult medical and surgical subspecialty patients. Each cohort followed the same schedule of introduction of the CHG bathing. So initially, no one had it, and then they introduced it on a Monday, Wednesday, Friday schedule as a staggered range until everybody was using the CHG baths every day. And then a 4-month washout period was conducted when the CHG was discontinued. For reduction of the CLABSIs, the only group that really showed a decrease in the incidence of CLABSI was cohort 1. And that was especially during the Monday, Wednesday, Friday use of the CHG bathing. And then it just kind of stayed the same during the everyday, but then it continued to drop during the washout period, which makes me think, what other infection control protocols were in place? Did they introduce something new during the study? Is there something that needs to be added? That was really the only significant finding along the lines of the central line associated bloodstream infections. However, the study did reveal that the use of CHG bathing did decrease the incidence of Clostridium difficile, but that was really it as for that study. The third study is called the efficacy of daily bathing with chlorhexidine for reducing healthcare-associated bloodstream infections is a meta-analysis. So this study, what it did was it was just looking at research that has already been done. Initially, they had looked at, I want to say 133 studies. 117 were eliminated because the chlorhexidine gluconate was being used for other purposes other than just daily bathing. This is probably the least favorite of my research, but it's pretty cut and dry. The research that they looked at was they had periods of just regular bathing with soap and water, and then periods of bathing with the chlorhexidine gluconate. And they did find a reduction of central line associated bloodstream infections with the patients using the chlorhexidine gluconate. The fourth study is probably one of the first studies of its kind. It is called the effects of chlorhexidine whole body bathing on hospital-acquired infections among trauma patients. Daily chlorhexidine bathing to reduce bacteremia in critically ill children, a multi-centered clustered randomized crossover trial. So, chlorhexidine gluconate could only be used on patients greater than 2 months of age. So this was the first study of its kind. No other trial has been done on the pediatric population. So this trial was called SCRUB, and it was conducted in multiple pediatric hospitals across the country in their intensive care units, including Johns Hopkins Children's Hospital of Philadelphia, St. Louis Children's Hospital, Seattle Children's Hospital, and Children's National Medical Center. What this conducted was 2 6-month periods and then a 2-week washout. The study was also taking place at the same time as the first study, so they made sure to include the period when the product was being recalled. They used 2 populations for the CHG bathing. One was the intent to treat population, and this included all eligible admitted children aged 2 months or older, except those whose caregiver refused to participate and did not consent to having protected health information gathered, and the per protocol group, which included all eligible children aged 2 months or older who received any treatment, and selected admissions who were not given because of defined exclusions. They didn't include admissions with defined exclusion in the per protocol population because because similar children were not identified. But in this study, they found 1,999 patient admissions to the ICU in the per protocol population. There were 41 CLABSIs that were identified in 30 admissions. 13 episodes were seen in the treatment and 28 in the control group. So there was definitely a decrease in that population. And then in the intent to treat, similar results showed that there was a decrease in the CLABSIs with the use of chlorhexidine baths. One weakness of the study is the fact that it is the first of their kind, that there's nothing really to compare it to. So it does weaken the study, but the authors made sure to say that the results that they received from the study was similar to that and what has been done in the adult population. the authors did make note that the use of the chlorhexidine baths did show a reduction with the gram-positive bacteria. Another thing that they talked about was in the pediatric population, it is challenging to define what eclampsia is. If a child is showing symptoms of eclampsia, or they're febrile or showing any signs of that, they typically draw blood culture from one lumen of the central line. And typically they're almost started on antibiotics immediately. But they did say that even the use of the chlorhexidine showed a decrease in the flora of the skin. So we're decreasing the bacteria on the floor of the skin, which can actually cause a contaminated blood culture, which can always look as eclampsia. The fifth study, which I think, in my opinion, was probably the most credible study of them all, is called the effects of chlorhexidine whole body bathing on hospital-acquired infection among trauma patients. So what this study showed was, it was done in a level 1 trauma center, connected in the trauma ICU. It was a 12-bed unit, and 87% of the patients that were admitted were under the trauma services. So what they did was just a typical bathing patients with soap and water versus bathing them with the chlorhexidine gluconate. The authors of this study made sure to note that there are protocols in effect for insertion of central line in general using the 2% chlorhexidine like swabs, and they also have other infection protocols for like ventilator-acquired pneumonia. So there are those things in place. They did make note to them. They said that the introduction of the 2% chlorhexidine gluconate to routine daily whole body bathing of the disposable washcloths in the trauma ICU was associated with the reduction of the incidence of the CLABSIs. They also said that the microbiology of the CLABSIs and the ventilator-acquired pneumonias also changed with the use of the chlorhexidine gluconate. They also found that there was no central line infections with Staph aureus, Enterococcus species, or Bacillus species, and 1/2 of the incidence of coag-negative staph. They also did mention too, like with the other articles, that by the use of the chlorhexidine gluconate, there was a reduction of false positive blood cultures, and that was just from the change of the flora of the skin. The authors also made note that they had a reduction to MRSA and MSSA, but they didn't find the chlorhexidine gluconate really effective against the gram-negative species like the Enterobacter, the Pseudomonas, the Klebsiella, that what it's supposed to be doing. So overall, studies that I did find did say that chlorhexidine gluconate is a good factor in reducing the number of central line associated bloodstream infections. I know some of them said that this isn't the only thing you should do. There should be other interventions in place to reduce them, but overall, it is a good intervention to have in place to reduce the number of central line associated bloodstream infections. These are my references. If you have any questions, please feel free to ask them on my Blackboard page. Thank you.